Hi, I'm Misty Wilkin, nurse educator, scientist, and certified specialist in poison information. I would like 10 minutes of your time to discuss the things you need to know so that you may provide the best care for your emergent poison patient. So, specialists in poison information, like myself, are medical professionals such as nurses, pharmacists, and providers. The Texas Poison Center Network includes a team of experts who are here to support and guide you when caring for your poison patients. By calling the Poison Center, nurses can contribute to better patient outcomes. Your local poison center is in Galveston, Texas. We are known as the Southeast Texas Poison Center. And as you can see here, there are 6 centers in the state of Texas. Sometimes when you call, you may get one of the other centers in the state, and that is fine. We are a network, all here to help you. I want you to recognize what is considered a poisoning, understand the Poison Center as a resource, know when to call the Poison Center, and understand the first steps in caring for the poison patient. You can see here to the right America's Poison Center's new logo. The number is here as well, the 1-800-222-1222. It is a national number. U.S. calls are routed based on area code of the phone being used. So I encourage you to call from the hospital's phone or issued cell phone to ensure you get the Texas Poison Center network and increase your chances of getting your local poison center. Just to clarify, what is a poisoning? It is defined as the harmful effect that occurs when a toxic substance is swallowed, inhaled, or comes into contact with the skin, eyes, or other mucous membranes. A few examples are drugs, snake venom, chemicals, and plants. To get an idea of the common types and number of calls poison centers receive, let's look at some data I retrieved from the most recent National Poison Data System report. This report comes out once a year in the Journal of Clinical Toxicology. Listed here are the top 10 single substance exposures in adults and children combined. When you call us, you contribute to this data, which is gathered by all 55 poison centers in the U.S. You contribute to improve patient care and outcomes across the nation. We make a chart or record of each call or exposure and track types and number as well as treatments and outcomes. As you can deduce from some of these types of calls and the number of exposures, we keep a lot of people out of your emergency rooms. We help patients decide if they or their children can be watched at home or if they need to go in. Now that we have discussed some of the types of calls we receive, I want to next discuss why it is important to call the Poison Center as a resource. We provide accessible and affordable healthcare support. Medical professionals are available 24/7 to help you care for your poison patients. We are a fast, free, confidential telephone consultation service. We can provide immediate clinical or medical toxicology consults to help with critical or complicated cases. We perform toxico surveillance. The Poison Centers auto-upload data on poison exposures to the National Poison Data System, or NPDS, on average every 9.5 minutes, which allows for real-time detection of surveillance anomalies and events of public health significance. Poison centers also provide professional education to medical students, medical residents, and fellows in toxicology fellowship training programs. We collect data for drug and product safety research. Calling contributes to the NPDS data, which can be used to monitor safety and clinical effects of new medications, chemicals, and emerging drugs of abuse. Poison center data are used to identify needs or defects in packaging and medication formulations and monitor recalls and public health interventions. In order to best care for your poison patient, I want you to know when to consider calling the Poison Center. These would include exposures involving ingestions, eye exposures, dermal exposures, and aspirations, unintentional medication ingestions, and intentional medication overdoses, insect bites and stings and venomations, chemical exposures, medication errors, drug-drug interactions, indications and dosage, and for your potential exposures of unknown origin. Now that you know what we do and when to call us, next I want to discuss the first steps in caring for the potentially poisoned patient. First, we start with the basics: airway, breathing, circulation, and of course, good symptomatic and supportive care based on your patient presentation. Does the patient need to be intubated and ventilated? What are the vital signs? Do they have a good blood pressure and heart rate? What does the EKG look like? Do they have prolonged QRS or QTC intervals? When performing the assessment and diagnosis, especially on an unknown exposure, it is important to recognize and understand sets of symptoms that are commonly seen with a drug class or type of exposure. These toxidromes can give us clues so that we can better treat the patient with an antidote or proper supportive care. Assess: what is the patient's mental status? Are they sedated or agitated? What is their temperature? Are they hyperthermic or hypothermic? And have they had any seizures or rigidity? Once you have assessed and hopefully stabilized the patient, the next step is to call poison control so we can discuss the patient exposure and assessment findings to help determine whether the patient is a candidate for decontamination or elimination procedures such as washing, diluting, activated charcoal, lavage, whole bowel irrigation, or hemodialysis. We can help your team decide what treatments may help, what antidotes may help, what treatments you should avoid, and what labs need to be ordered or drawn. Common labs include the osmolar gap, anion gap, renal and liver function tests, acetaminophen level, salicylate level, CBC, CMP, urine drug screen, and alcohol levels. Also, with some exposures, the patient may also need a chest x-ray or abdominal imaging. As part of your assessment, especially in an unknown exposure, it is important to recognize and note sets of symptoms that could correlate with a toxidrome. This can give us an idea of the type of exposure, which can help with effectively treating the patient. When assessing the poisoned patient, observe and note mental status, pupil size, heart rate, blood pressure, respiratory rate, skin presentation, bowel sounds, and temperature. Just to get an idea, here's an example table of a few common exposures and their antidotes. When you call the Poison Center, we will discuss indications and management of these patients who may benefit from a specific antidote or treatment. If an antidote is recommended, the Poison Center will continue to call back as needed to check on and continue to help you manage your patient. The last thing I want to discuss is a few tips for when you call the Poison Center for guidance in patient care. When giving the specialist in poison information or the agent that answers the phone report, think about the common charting mnemonic SBAR: situation, background, assessment, and recommendations. Have your patient demographics ready. Be ready to discuss the patient's situation and background. Report your assessment findings, including mental status, pupil size, vital signs, labs, and EKG findings. Based on above information, the agent will make a treatment recommendation. When you call, have your pen and paper ready so that you can write down our recommendations. Document the recommendations given, agent name, and Poison Center case number in your nurse notes. This will help ensure that the provider or other members of the care team can see what we discussed as well and provide a better continuity of care. Just a quick list of my references here. A few quick resources and our phone number here. Poisoncontrol.org is where you go to order materials for your emergency room or pharmacies, including stickers and magnets and antidote charts. Our phone number here, America's Poison Centers, 1-800-222-1222. And then a website that is a good reference for learning more about toxicology, ToxTutor. Thank you.